Hello, welcome to the YWCA's Talk on Health. This is a conversation done in collaboration with the Lower Cape Fear YWCA and the Wilmington chapter of Delta Sigma Theta Incorporated. We welcome you here today for our exciting conversation on Memories Matter, Alzheimer's disease, remembering those who cannot remember. Thank you for joining us. We have a wonderful panelist today. I'm going to give you a little bit of background about Alzheimer's disease and the impact that it's having on us right now. An estimated 6.2 million Americans aged 65 or older are living with Alzheimer's disease. It's estimated that that number could grow to 13.8 million in 2060 if we don't find a great medical breakthrough to prevent, slow, or cure Alzheimer's disease. Unpaid dementia caregiving from families, though unpaid dementia caregiving, is estimated to be $256.7 billion in 2020. The Medicare also ends up paying a lot more per person with Alzheimer's disease. We've talked about the time for the family and the amount of money, but the emotional toll is also the biggest part of Alzheimer's disease. The toll that is felt by the families and by the people that are living with Alzheimer's disease. So I'm excited to get into this conversation today. I'm sure that it has touched many of our lives. As always, I do have to begin though with a statement from the YWCA. This is a land acknowledgement. The YWCA of Lower Cape Fear serves the people located within the Lower Cape Fear region. This land once thrived with life from indigenous peoples, known today as the Cape Fear Indians and the Waccamaw Siouan Indian people, living in established settlements along the Cape Fear River and Lake Waccamaw, along with many other established sites in the region. We need to protect and honor the history of these places. Indigenous people are not relics of the past. They are still here, continuing to demonstrate their talents and gifts amidst a backdrop of ongoing colonialism and oppression. They are worth celebrating. We hope our land acknowledgement statement will inspire others to stand with us in solidarity with Native nations. Thank you very much. We'll start out today with Dr. Goldie Bird, and I'm going to allow her to introduce herself. Can I also ask you guys to mute yourselves when you're not speaking? Thank you very much. Okay, Dr. Bird.
Good afternoon. My name is Goldie Bird. I am Professor of Social Sciences and Health Policy, and I direct the Maya Angelou Center for Health Equity at the Wake Forest School of Medicine in Winston-Salem, North Carolina. I conduct genetics of Alzheimer's disease in African Americans.
Thank you very much for being with us today.
Thank you.
And next, we will have Ms. Holly Pilson.
Good afternoon. I'm Holly Pilson. I'm the Area Agency on Aging Director with the Cape Fear Council of Governments. We are a regional planning agency mandated by the Older Americans Act of 1965. And we coordinate and organize all of the Older Americans Act fund programs like home delivered meals, congregate nutrition, senior center programs, family caregiver support, long-term care ombudsman, and a North Carolina Project care program.
Thank you, Holly. And next we have Ms. Melanie Bunn. Can you please introduce yourself?
Sure, I'm Melanie Bunn. I am a registered nurse and I get bored really easily. So I do a lot of different kinds of things with a lot of different kinds of people. But I'm grateful to be here today representing Dementia Alliance of North Carolina, which is a nonprofit. I'm also involved with the Duke University School of Nursing and teaching nursing students how to do a good job working with people living with dementia. I'm on some research grants there as well. And I also am involved with Teepa Snow and her Positive Approach to Care group. And I do other stuff.
Thank you very much, Melanie. I am Dr. Lakeisha Jarrett, and I'm a family medicine physician working for Wilmington Health in Leland. And I get the opportunity to come moderate these groups every month, and I really enjoy it. There's always a wealth of information for me and for the community. As far as the community goes, if you have any questions, please put your questions in the chat for us. Thank you very much. So we'll start out. What is the difference between Alzheimer's dementia, disease, and dementia?
So I didn't hear the beginning
I'm
of.
sorry, I misspoke. The question is, what is the difference between Alzheimer's disease and dementia?
Okay, and so you're talking to me, Lakeisha. I didn't quite hear your beginning. So is that a question for me, or is that for the
It
panel?
is for anyone who would like to speak, but yes, you may begin.
Okay, so I will begin. The Alzheimer's disease is a type of dementia. So when we talk about dementia, we're talking about a general condition, and many things can cause dementia. But we call dementia an umbrella term simply to talk about the loss of memory and the inability to do your activities of daily living. And it's just we call it an umbrella term because it under that umbrella are many different types of dementia. So Alzheimer's disease is the most common type of dementia.
Okay, thank you very much, Dr. Bird. Does anyone have anything else to add to that answer? Okay, we'll move on to the next question that we have. What are the early signs of Alzheimer's disease? We like for all the panelists to participate if you want to, but Dr. Bird, if you would like to speak first, you could go ahead.
So some of the early warning signs, one of the signs that people usually suffer with that we recognize is just repeating ourselves, things like that, or forgetting things, recent memories. The thing about Alzheimer's is that we often remember those things that happened many years ago, but this memory loss is a huge piece. And so you could be talking to someone and they might say something, and then in 5 minutes, they might say that same thing again. And they may get lost. They may forget the day of the week. They may forget things that they're most familiar with. And so that memory loss is a big piece. Sometimes the visual spatial aspect of their lives gets changed. And so those early warning signs, what we see most often are those early memory losses. And the thing that really aggravates families is that repeating. And that's because the brain is forgetting things. To confusion, some behavior that is out of the normal. As time goes on, they might even hallucinate or see, begin to see things. But those things that are kind of out of normal in terms of their cognition, they may forget how to write a check to pay bills. They might buy 3 cars in 6 months after a while. And so, so those kinds of things that are, they begin very subtle, but then we begin to see them more and more. And sometimes it's in a very short period of time, even though the disease itself can be a long-term disease.
Thank you. Holly, do you have something to add to that?
I think Dr. Burke covered it. She covered all of the things I would say.
Okay. I'll add that, a lot of times there is some normal memory loss that is associated with aging. So sometimes, forgetting where you put your keys, or you walked to the next room and forgot what you went to the next room for, which I see, a lot of people come in and they say, oh, I don't know if I'm having memory issues because I forget that, but it's not quite the same thing as dementia. So there are tests that we do, or that your doctor should be doing, in order to determine whether what you're presenting with is normal memory loss or if it's something different than that. Melanie, did you have something to add?
Yeah, the only thing I might add to that is, when the question was specifically about Alzheimer's disease, and absolutely, the other dementias might have some, might look slightly different at the beginning. So, for example, somebody with Lewy body dementia, they might start with some tremors and some rigidity. So they might start with having falls, and the memory changes isn't the, or the thinking changes isn't just memory, it's kind of like more erratic. It's like sometimes they can get things and sometimes things aren't there. And so for frontotemporal lobe dementia, the first changes might be some language changes. So thinking about that umbrella, all of them are going to kind of show up a little bit differently at the beginning and then are going to change a little differently as time goes along.
Right. Thank you for adding that, Melanie. Does anyone else have anything to add to that conversation?
I think that is a great point that Melanie brought up. And I think one of the things that we can advise families to do is when we see changes in general, it's time to be alarmed, and we should get to a provider as soon as we can. Because it could be something as dementia could be something as simple as some toxicity to something, and so like a drug. And so we could get some of the signs and symptoms that we're talking about. We could get something. The patient could be having any kind of change, and so therefore we need to get some help. So when we see these changes, I think the takeaway is that we should get to the doctor as soon as we can.
Right. I'm sure we're going to address this a little bit later, but I think one of the most challenging things is that people with memory issues don't tend to come to the doctor themselves to say that they have memory issues. So it really involves the family and caregivers a lot too. But I'm sure we'll talk about that a lot later. And that's where, and Holly will have some things to add for us there too. What are the causes of Alzheimer's disease?
So that's a great question. That's $1 million question, because we don't know particularly. There are many associations with Alzheimer's disease. There are many things that increase risk, but the one thing that actually causes it, we don't know. We do know that when there are two kinds of Alzheimer's disease. There's an early onset, and then there's the late onset, which we know more about in terms, there are more patients, so there are only about 200,000 early onset patients, and then the other 6 million that you talked about, Dr. Jarrett, are the late onset. And so the early onset, it's inherited, basically, primarily inherited. The late onset, there are genetic influences that predispose people or that increase risk for Alzheimer's, but it is not inherited in the same dominant way. So things that we know are increasing risk for Alzheimer's are the way we live. As a matter of fact, there was a recent article in the journal Lancet that says up to about 35 to 40% of the dementias could possibly be prevented if we modified our behaviors. So the kinds of behaviors that they're talking about are blood issues like hypertension, high blood pressure, stroke, diabetes. So those kinds of blood issues, because Alzheimer's is a blood disease because we have so many blood vessels in our brains. And so what's happening within those vessels and nerve cells are contributing to the Alzheimer's disease. So if we can modify some of the behavior, it is predicted that we could decrease the Alzheimer's type dementias. Now, there are other issues, such as what we term the social determinants or social drivers of health that contribute to increased risk or increased prevalence of Alzheimer's disease. So those kinds of things are like where we live, our communities, those early childhood experiences, we call those ACEs. Are we living in toxic dump areas? Are we living in areas that are violent? Are we living and working in areas that are really racist and discriminatory? And we're dealing with those kinds of experiences every day. Are we eating appropriately? Are we exercising? Are we reducing our BMI? So those things that are important for, say, cardiovascular disease are the same kinds of things that impact prevalence of Alzheimer's disease. So is there one magic bullet? We don't know what that is. We know that these plaques and tangles are in the brains of Alzheimer's patients, but we don't know if that's because of Alzheimer's or if it's causing Alzheimer's. So there's a lot of great research around that now, but in terms of any one thing that's doing the trick, we don't know that yet. That was a long answer. I apologize.
That was a perfect answer. Thank you very much. I would also like to add smoking, which you didn't mention,
yes,
because that is a big circulatory problem, because if you have that type of constriction to your arteries, you're not getting enough blood to your brain.
And I would go as far as saying sitting in front of these screens all day.
Oh,
probably
yes.
That
really doesn't challenge you. I do like to, I don't think that we can necessarily prevent dementia by giving people things to do, but I always like to tell my patients they should exercise their minds as well as their bodies. And sitting in front of a screen is definitely not exercising your mind very much.
Oh, body. That's great. That is so good.
So puzzles, jigsaw puzzles, Sudoku, things, and just staying active and socializing as much as possible.
Mm-hmm. Yes, absolutely.
Well, and while we're kind of exploring, a couple other things, some of the most interesting research is looking at sleep. And that if sleep is chronically disturbed, so people who work shifts or people who have sleep apnea, your brain has to have sleep to heal and to clean it and to store information. So sleep is critically important. And then something else that I'm really passionate about is managing depression. Depression seems to be independently a risk factor for dementia. And especially untreated depression. And there is a lot of discrimination about issues of managing depression, managing anxiety, that I think working through some of those is also going to be good for human brains.
That's very good, Melanie. Thank you for mentioning that. Also, depression and anxiety can often be confused with Alzheimer's. So, people can't function and answer the questions and remember things because they're depressed, as well as hearing loss is another thing that either, I don't know if it's really causative or just confused with Alzheimer's.
Yes, hearing loss is a big issue
Right.
associated with increased risk. And so many people have hearing issues that we have sort of ignored in our populations. And so getting that hearing checked is very, very important.
And for some reason, people don't like to wear hearing aids.
That's right.
They're not perfect, but it definitely enhances what is going on. Sometimes people say they're too loud, or the vanity of wearing a hearing aid tends to be worse than the vanity of wearing eyeglasses, which I don't understand. So, but yeah, that's hearing is very important. Yeah. So, is there a cure for Alzheimer's disease?
No.
Okay.
Unequivocally.
Can anybody expand on any of the treatments?
Well, most of the treatments we have work on the chemicals, not on the structure of the brain. And there is one new medication that's just become available that might be doing something a little different. And you might have had experience with that and might be better able to speak to that. I haven't really known anybody who's actually taken it, but it's new and it's expensive and it isn't well studied yet. And it might turn out to be something amazing and wonderful, but there's still a lot of questions to be discussed and answered and explored.
Thank you for saying all that, Melanie. That's very true. It is, unfortunately, when new medicines come out, they are often priced out of anybody's availability. I think the only thing to do would be to get in a study probably at this point for the medication. Yeah.
My understanding is they do have some resources available to kind of support people who need support in taking it, and that's wonderful. I don't know exactly how that works, but I have read something that says they do have some resources available, but it's a really complicated road right now.
Right. Yes. And families are definitely looking for treatment. They want treatment really badly, and people with dementia want treatment really badly, but the side effect profile is a bit high for that too. So like you said, it might turn out to be wonderful, and I really hope and pray that it is, but we don't know yet. We know that we haven't really seen much benefit to the drugs that we have now, unfortunately.
Right. They typically work on some of the symptoms before Aduhelm or aducanumab, which is the new drug. And as you said, I think it's about $50,000 a year. I mean, it's really expensive. And there was, I am sure people on the call have heard about some of the FDA issues around that drug. And it does cause some side effects that are not too pretty. So it does speak, Dr. Jarrett, as you mentioned about clinical trials, it does speak to the importance of participation in trials, because when there is a drug available or an intervention of some type, we want all populations to be involved in the efficacy of those drugs. And so when we fail to participate in trials, then certain whole populations may be left out of the knowledge gaining for that. So the importance of participating in studies and trials cannot be overstated.
Are there any trials going on where you are, Dr. Bird?
Yes, there are trials going on here. There are studies going on here. We actually run a study in African Americans, but we also have an Alzheimer's disease research center. And I know that there's one now at Duke, and I think Duke and Carolina have one. And so at these centers, there are many trials and studies ongoing. And so we encourage people of all colors and races and ethnicities and background, socioeconomic status to check into getting into a trial or a study of some type to assist in finding answers for this dreadful disease. I mean, it's going to take a whole community to do this. It's not, most of the drugs that we know about were made based on the participation of white males right. Historically. And so the National Institutes of Health in 1993 published what we called the NIH Revitalization Act to assure that women and people and minorities are included in studies and trials, because it is not appropriate to take what we know from one population and generalize that information to everybody else. And so when we saw that kind of thing happen even with the COVID pandemic, there were different populations of people who were reluctant to get involved in testing and the vaccination and that kind of thing. But it does take the whole community to answer questions appropriately about diseases and conditions.
So Dr. Bird, do you pull from all over North Carolina, or do you have people coming in from all over the Southeast, or who would be good participants for for the research that you do at Wake Forest?
So the research that we do is in AD is we're looking to see why African Americans have Alzheimer's twice more than whites. And so we're doing a genetic study, a big genetic study. We're looking at families who have Alzheimer's in them. So we're looking for people who are affected and people who are unaffected. And we need thousands of people involved in the study. And so we go to the patient. So if a person is in their home, or if they're in a home or residence home, we go to the patient. Now, many studies require that you come to the hospital because they may involve PET scans or imaging of some type, or they may involve some intervention that requires the person to go to the hospital. But for our study, we just require blood draw and some cognitive assessments. So we actually can go, we're funded to go to homes or to wherever the person is. And often we get people, 3 or 4 in a family. Our largest family has 14 members. Can you imagine a family with 14 members with Alzheimer's disease? And so we do an inordinate amount of work around education. I work with Melanie Bunn in the past.
Right.
And
now you said, is that just all over North Carolina?
We're all over the country, because sometimes you may have a sister in California, so we will get that work done through different means, but we will get those families wherever they are.
And is there any treatment involved in that program, or is that just the genetic research?
No, there's no treatment in this one. They don't have to take any medicine for this.
Okay. Thank you. Holly, what do you want to add?
Yeah. I was going to ask Dr. Bird and Melanie, remind me, I think there's a registry for brain health in North Carolina where you register, and all of the different research organizations use that registry. So if you're interested in being a part of it, whether you have a memory impairment or not, I think they want to study all brains. And I can't remember what the website is. I'm hoping Dr. Bird or Melanie, if y'all would just give me a hint, I can look it up and then I can put it in the chat.
So thank you for that, Holly. You're talking about the North Carolina Registry for Brain Health.
Thank you.
And I'm actually a PI on that registry as well, principal investigator on that registry, but it's housed at Duke. And the University of North Carolina at Chapel Hill, East Carolina, are also, and North Carolina A&T State University are also involved in that registry. And all people have to do is give us their names, and what happens is once they do that, they go into a registry. Basically what they're saying is they either want to get more information about Alzheimer's disease, or they want to participate in a study of some type. And so what happens is when investigators need study participants, they get to, potential participants will get an email asking if they want to participate. So that's another way to get involved. Yeah.
It's ncbrainhealth.org. So pretty.
Thank you so much, Holly. Can you put that in the chat, please,
so
that people who are tuning in can find that information? Thank you.
And I will put and Dr. Jarrett, I'll put our 800 number in the chat as well for our study.
Thank you.
Mm-hmm.
Thank you very much.
Another thing that's happening at many institutions now as well is people are looking for people to agree to donate their brain tissue when they pass away. The way to really get the only way to get a definitive diagnosis is unfortunately at autopsy. And so there are a lot of studies being done now looking at the expression of genes, looking at the pathology of brains. And there's so few people willing to do that. And for many reasons. I mean, there are religious reasons and there are just uncertainty reasons, but more and more people are beginning to donate brain tissue to do an autopsy.
Very interesting. Where can I find financial help for people with Alzheimer's disease or their caregivers?
Finally, a question I think I can take on that.
All right.
Thanks for the help, folks. So within our Area Agency on Aging, we allocate funds from the Older Americans Act Family Caregiver Support Program to each one of our lead agencies in our 4 counties, which are Brunswick, Columbus, New Hanover, and Pender. So in New Hanover County, it's the New Hanover County Senior Resource Center on the corner of Shipyard and College. You can call there and talk to any of their social workers. And in Brunswick County, it's Brunswick Senior Resources Incorporated. And they have a case manager at every one of their senior centers that can tell you about the Family Caregiver Support Program. In Columbus County, it's Columbus County Department of Aging. And in Pender County, it's Pender Adult Services. So we have that where it can give you a little bit of respite, some supplemental services like maybe help with purchasing incontinence supplies or nutritional supplements. Information and referral is huge. Caregivers call and they get that information they need. You know, where are the services? How can you connect me to like Dementia Alliance or the Alzheimer's Association? Folks like that. We also have the long-term care ombudsman program within our agency, and they're the advocates for persons living in long-term care. And we all know that sometimes we may have to place our loved ones in long-term care, and they're the folks that can tell you which ones have a memory care unit, what the pay sources are. And then we also have a North Carolina specific project called Project Care, which is caregivers alternatives to running on empty. And you know, we're so excited that North Carolina looked at supporting caregivers and they fund this program. And Dana Bentley is the contact here within our agency, but she covers 12 counties and is able to allocate vouchers, $500 vouchers to give caregivers a break. But Project Care is all over North Carolina. So are the other programs I mentioned within other area agencies on aging. We run support groups. We have a list on our website of all the support groups, which I will put in the chat. We do educations. We do a lot of one-on-one information and referral. And when COVID is gone, hope to get more in person doing caregiver educations, but we've missed that quite a bit.
So I heard you mention respite care. Is that a definitive time, or is there any ongoing respite care? So are there any programs that you know of where people can take someone maybe every Wednesday for respite care, or is it just like when they go out of town for 2 weeks, they have respite care?
So there's different options. There's an adult daycare in New Hanover County, Older House by the Lake. And that's a great adult daycare if you ever get a chance to go by and visit. They do a really good job. Our caregivers have really enjoyed taking their loved ones there. There are some grant funds that can cover some of that. The Family Caregiver Program can also. And then otherwise, they usually contract with home care agencies to do the respite. Now, it is temporary emergency respite, so it's not ongoing, as you asked, Dr. Jared. It's kind of for people that have a plan. You know, I have to go to a wedding. I know I'm going to have surgery, something like that, where they can plan for that respite time. As we all know, respite's so expensive, you know, hiring people in. And right now, it's really hard to even get the caregivers on board within the agencies. Are having a hard time covering. But the voucher program is a little different because they can hire whoever they want. It could be their neighbor that they trust to watch their loved one who knows them. It could be a distant cousin. As long as they're not living within the home, they can hire whoever they would like to cover that.
Oh,
we may have
that's great.
more towards that type of program
right.
for that. So yeah, that's and then, you know, even Medicaid has looked at Alzheimer's disease, and now they have certain slots for certain parts of their programs for people with a memory impairment.
When you mentioned that being able to get like a neighbor or trusted family member, I thought about bringing someone in to a patient with Alzheimer's and how they don't always deal with strangers very well. And so that would be good, I guess, if there's someone who's familiar with them.
We always suggest to ask the caregiver not to wear their agency shirt when they come that day. Introduce them to a friend, you know, do those types of things where they don't feel like there's a stranger coming in, but maybe it's a known friend of a daughter or friend of a church member or friend of a neighbor, so that it's not a stranger coming in.
Thank you, Holly. Anyone else have anything to add to that about resources? I saw, Melanie, that you put in a resource in the chat.
Yes, Dementia Alliance of North Carolina is, you know, Holly has mentioned it and Dr. Bird has mentioned as well, for education, support groups, resources, referral. Sometimes can provide some emergency support, primarily not their main thing, but you know, sometimes there are resources.
What are the particular challenges for caregivers of people with dementia? Can you all talk about some examples or any general things that the caregivers struggle with?
Well, I think one of the main things that's kind of universal is that dementia changes all the rules. You know, so this is my spouse who was always the one who did the driving. And now that spouse isn't doing the driving anymore. This is my mama, who taught me manners, you know, and taught me how to behave myself. And now we're walking through a restaurant, and mama reaches out and grabs French fries off somebody's plate as that we walk through the restaurant. And this is my mama who taught me how to behave myself. And I think for especially for family care partners, that's just beyond the financial pieces and the legal responsibilities and all the other pieces. It's that kind of, this person isn't the person that they used to be, and those rules and those family rules and those relationships are just different. And people like me and Holly and Dr. Bird now start saying, so now you have to change. You know, the dementia's changed, now you have to change. And often, that's hard enough when, Dr. Bird was my mama, and she was a wonderful mama, and I love her, and she took great care of me. It's hard enough. But if my mama wasn't a great mama and didn't take really good care of me, and now people like us are saying, but she's being hard to get along with because of dementia, and the family is saying, no, I'm not buying it. She's always been hard to get along with. She's never been, that person that you're never been that way, always been hard-headed, always been stubborn, always been selfish. This is not dementia. This is my mama. And I think that is what makes it so hard for families, and the piece that what people hear on through media and the message that gets promoted is dementia is memory lost, and that is a small part of it, but it's so much more than that. And so people who aren't living through it, aren't experiencing it closely, try to be helpful, but they really don't know what they're talking about. So there's this tremendous sense of isolation that the family who used to help now don't know what to do. People in the faith community who would be willing to help if they knew what to do. There's just this tremendous sense of isolation often. And that's where reaching out to groups like Holly's organization, groups like Dementia Alliance, groups like those associated with Dr. Bird's organization, reaching out to spend time with people who get it. That's what really makes the difference.
I would like to add that, a couple of things that you said, like particularly the spouse, like you married someone who was your partner, and now you're the caregiver, and they are not behaving the way that you expect them to behave. And, no matter how many times you say it's not the person, it's the disease, it is really difficult to figure that out. And as with all mental health, it is so much easier to get people to understand if you broke your leg or you have cancer and it's something that they can see, then that they have mental health issues, especially dementia. And so, as a community, I hope that people are listening and will be more understanding with that too. That just because people look healthy, and some of my healthiest patients have dementia, so that is that's really difficult for people to understand. Would anyone else like to add anything about what type of issues the caregivers have? I'd like, if anyone knows anything about financial issues, I would like to speak on that, because I have a lot of experience with friends also who've been through dementia, and, mothers who are spending money or sending money to a prince in Antarctica or whatever, all sorts of things. So if you have any suggestions about that or experiences with that you would like to share, that would be interesting also.
We do a lot with elder abuse prevention with our agency. We have a Cape Fear Elder Abuse Prevention Network, and we do a lot of scam and fraud education. And a lot of times it is that they take advantage of the vulnerable or lonely or socially isolated person, and maybe they do have a little bit of dementia and aren't quite, on top of it, but they get all kinds of people. It doesn't necessarily mean you have to memory impairment to fall for those. We do have a letter that our local Secret Service office just wrote about local scams they've been hearing a lot of that I can be sure to send to you all so you can share it. We've sent it out to all our home delivered meals clients and the congregate nutrition folks. But I always say that you can freeze your loved one's credit with all 3 of the credit bureaus for free if they're over the age of 65. So that would mean if it was your husband, they would just call you first and say, hey, I've gotten an inquiry for buying a car. Is that something that you're approving of? And then they would unfreeze your credit so that you could apply for that car. So I think that's a good idea. The do not call registry is a good idea. I can't promise it makes all the telemarketers stop calling, but some people have changed phone numbers even because once that telemarketer gets that person and knows they're going to talk and maybe send them some money, they're going to call repeatedly. If you go on to the Attorney General's website, there's also where you can stop the mailings so much. Maybe you open up a PO box for the real mail and you get to the mailbox before your loved one does every day and take out the publisher's clearinghouse things first. So those are just a few suggestions.
I've definitely heard the Publishers Clearinghouse one too recently. Yeah,
it's been around a long time. People feel
right.
this out for a very long time.
Right.
Yeah, one of the other areas around finances that I would like to raise is helping families to prepare when they get an Alzheimer's diagnosis. So it's not only the scams and the inability to take care of financial concerns, but it's also, do we have our business in order? Do we have healthcare powers of attorney? Do we know what a family member would like to have done in life and death? Do we have the family farm or the family house in a space where everything is not lost? And so the financial side of this disease is extraordinary. And people usually suffer who are caring for patients with Alzheimer's, physically themselves, caregivers, physically, socially, psychologically, emotionally, and financially. So often women particularly may have to come out of the workforce, or they may reduce their hours, or they have the extra burden of care and work. And so it can leave a family strapped financially. This disease can rob families in so many different ways, and finances. One of those areas where we hope families can get some financial advice when they get this diagnosis.
Thank you for adding that. What are the statistics concerning people of color with Alzheimer's, Dr. Bird? You spoke about that a few times, so can you tell me about those statistics?
Yes, so people of color, so first of all, in terms of prevalence, African Americans have Alzheimer's twice more, and Hispanic Americans have it 1.5 times more than whites. So it's really prevalent in communities of color, American Indians as well. And so there's that burden. Not so sure about the incidence, but in terms of the prevalence, when I say incidence, I mean the number of new cases, but in terms of who actually have it, these communities of color, and we believe that it's related to those same behavioral things, the other risk factors that we're talking about, where these communities have been historically and intentionally marginalized. So their health in general is worse. And then in addition to that, there are delays in diagnoses, and there may not be diagnoses at all, because, and particularly given where we live, and sometimes I grew up in a small town not too far from Wilmington, and the medical access to medical care was not particularly good. And so we would, and I have family and community members who would go to the doctor and they would not get a diagnosis of Alzheimer's disease, or, and so I think the Alzheimer's Association suggests that about 40% of the time, people with Alzheimer's don't get the diagnosis. They just don't get the diagnosis. And so there's been a big debate around that in terms of, why would a primary care doc, as an example, suggest that you have Alzheimer's when there's no cure? Well, the truth is we do want them to give us a diagnosis or make a referral to a neurologist or specialist, because the sooner we can get a diagnosis, the better chances we have of doing something about it, or at least preparing. I think Alzheimer's is a family disease, and sometimes when there's an Alzheimer's diagnosis, people flee, they run. But we have to do a better job of sharing with our families and our communities and our churches to provide those circles of care so that it doesn't kill the caregiver. And because if that happens, then we got a real big problem. But so there are many things that contribute to this increased prevalence of Alzheimer's disease. And that getting a diagnosis is one of those things. This is why we were saying at the beginning of the panel that when we see things that are not normal for that particular person, it's time for us to get moving and to get answers. And then, the other thing is, and Dr. Jared, I know you see this as a provider, these patients are really good at hiding stuff when they get in your office. They can just, they can hide it. They can hide it, but as soon as you get them outside of that office door, then things happen all over again. So they need care buddies. They need family members, and family may not be blood family. It could be community family, a church family, whatever. But we have to do a better job of helping our loved ones get the help they need.
And I love it when family members call to let me know what is going on, because like you said, people are really good at hiding it. I think the people who come in and say that they are having a memory problem are not the ones that are having the memory problem. Well, so, often I'll ask, well, are your children saying that you're repeating yourself, which is something that, you mentioned earlier a lot. Yeah, family is just so important. You're right. It is a family diagnosis.
And that what you just said too. I mean, often people, and particularly when they are living with someone with cognitive decline, they may have what we call subjective cognitive decline, which they declare out. They have Alzheimer's disease. They don't have Alzheimer's disease, but they've got all these other things that make them think they do. And so to them, it's very real that they have it when really they don't. So it just means that we need to pay close attention to ourselves and try to get the help that we need.
Holly, you had something to say?
I just wanted to mention that we are a part of dementia-friendly communities. So we're working on it in this area. We do a lot of Dementia Friends informational sessions, which I think are quite eye-opening for community members. So we do those in churches and in senior centers, and we've been doing going online a lot, which is still, I think, effective for the groups. And it's the same message, the same 5 key messages all across. It started in the UK and now it's in the United States. And then I also wanted to mention just for our—
Holly, can I interrupt you and ask if you could put where people can contact you if they want you to come speak at their church?
Of course. I'll put it in the chat. And also we have one of our local hospices has a dementia grant. So they have a Memory Partners program where they have a nurse case manager on staff and a social worker. And they've also been trained in the PAC, the Positive Approach to Care by Teepa Snow, and as has our family caregiver resource specialist here. So we have some access there for a program we've never had before. So it's exciting to have a new program to be supportive of caregivers in our area. And then we also host, usually we try to do it quarterly, a Forget-Me-Not Cafe where people can bring their loved ones with memory impairment. And it's just a really fun celebration. We had one this past week and it was awesome to see the caregivers with their loved ones enjoying some time together, because I think socialization kind of becomes null and void. Once you're diagnosed, you lose your old friends and you can't make new ones. So we love those Forget-Me-Not Cafes, and my staff went, and it just reminds us it's why we do what we do, because we love these people so much.
Well, believe it or not, we're out of time. If you guys can say something in 10 seconds, 10 to 30 seconds that you want to leave with the community, please give us a little 10-second memory or thing to remember. Melanie, I'll let you go first.
Reach out. Don't have to do it by yourself.
Thank you. Holly?
Enjoy the times of joy, the moments of joy. Just remember those and focus on them.
Dr. Bird?
Get the help that you need.
All right. Thank you all so much. This was a wonderful conversation. I wish that it could go on much longer. And we will be getting in contact with you for more information. Thank you.